Hi, good afternoon. My name is Karen Gleason. I'm the Director of Patient Care Services here at the Montauk Cancer Center. Today we are going to be discussing the roles of nutrition in cancer prevention and separating the facts from the myth. I'm happy to be joined today with Hillary Sachs, Senior Dietitian at the North Shore-LIJ Cancer Institute, as well as Dr. Mason, who is the Chief Fellow at the North Shore-LIJ Cancer Institute. Good afternoon, Hillary and Dr. Mason. Can you hear us?
Good afternoon. Hi.
Great. Can you just introduce yourselves for our viewers?
Hi, I'm Hillary Sachs. I'm a registered dietitian and board certified in oncology nutrition.
I'm Chris Mason. I'm a board certified internist, and I'm the Chief Fellow in the Department of Hematology and Oncology.
Great. Thanks so much. We have many questions today about nutrition we'd like to have answered. I was wondering if you can please talk about the role that nutrition plays in cancer development, and why is it important to separate those facts from fiction in this area?
Yeah. Well, the American Institute of Cancer Research estimates that as many as 1 in 3 cancers can be prevented with proper diet, nutrition, and lifestyle factors. That being said, there's a lot of misinformation out there, especially with the media and on the internet, so we really look to evidence-based information to help guide our patients.
Nutrition is very important. You are what you eat.
Great. Can you tell us who is the American Institute of Cancer Research, and why do we rely on their findings and their guidelines?
Well, the AICR is a nonprofit organization that funds research in preventative oncology for institutions and large health systems, and they believe that everyday choices can reduce our chance of getting cancer.
Their website's great too. There's lots of really friendly information and recipes, so I definitely suggest checking it out.
Great, thanks so much. Many patients ask us about the role of sugar in cancer development, and what role, if any, does that play?
It's a really great question, and we get this question really often. So sugar in the form of glucose actually feeds every cell in our body, our healthy cells, and if present, unhealthy cells as well. Even if we don't eat any form of carbohydrates, our bodies will actually convert proteins and fats into usable glucose or sugar for the rest of our cells to use. That being said, it's important to distinguish between different kinds of carbohydrates or sugars. Certain kinds of sugars, simple sugars, like cookies and cakes and white flours, don't offer much cancer-fighting nutrition and also don't have a lot of fiber, so they can cause more blood sugar spikes, leading to inflammation and, possibly even an unhealthy body weight. Whereas complex carbohydrates are full of cancer-fighting nutrients and fiber. So ultimately, if you eat too much of any food group, that's not good for us. But specifically, eating too much sugar or refined carbohydrates without fiber, without nutrients, is not great as part of a cancer-fighting diet. We really want to look for colorful fruits and vegetables and whole grains as much as possible.
Great, thank you. Another frequent question that we often hear is about an alkaline diet as opposed to an acidic diet. That having an alkaline diet can help decrease cancer risk and growth. And what are your thoughts on that?
Yeah, many patients ask about this, and there are a number of supplements out there, alkalinized water and things like that. I think it's important to recognize that our body maintains our pH very rigidly from about 7.36 to 7.4. And so regardless of what you take in, we have enzymes in our body, carbonic anhydrase, and organs, the liver, the lungs and the kidneys, that help to maintain that pH regardless of what you eat.
Absolutely. And it just happens to be that a lot of the foods that are considered alkaline happen to be healthier foods, again, that offer other cancer-fighting nutrients, fruits and vegetables and things of that nature.
So eating a healthy diet is important, and not necessarily focusing on the pH of the foods that you eat.
Great, thanks so much. The role of gluten seems to be everywhere in the media. Does gluten intake have any impact on cancer development?
Yeah, another very frequent question that we get. I think for that question, we need to separate patients into two populations. One of which are those patients that have celiac disease or gluten intolerance. So those patients really do need to adhere to a gluten-free diet. If they don't, they may have an increased risk of certain intestinal lymphomas and small bowel malignancies. But for the general population who don't have that, there really is no recommendation to avoid gluten. And in fact, following a gluten-free diet may limit their ability to take in certain nutrients and fiber. If you were to look at the gluten-free products, they're just as processed, and some of them also have, very simple sugars and carbohydrates.
Yeah, absolutely. Unfortunately, now a lot of places are using it as a marketing tool. Potato chips and French fries are technically gluten-free, so just because it's gluten-free doesn't mean it's healthy.
Doesn't mean it's healthy.
Yeah, if you have any questions or have symptoms of celiac disease, we'd recommend you to see your doctor and mention screening, because it's very easy to screen with a simple blood test.
Should we be avoiding meat as part of a cancer-fighting diet?
Yeah, this is a really great question, especially in light of the World Health Organization, or WHO, recommendation that came out just this week. We do know that eating a plant-based diet, again, is going to offer us the most powerful phytonutrients that are beneficial for our health. This does not necessarily mean becoming a vegetarian. It may mean making meat more of the side dish rather than the main dish. That being said, there's different quality and different kinds of meat that is important to be aware of. For example, processed meats that contain nitrates, that have been smoked or cured, we do know contain carcinogens or cancer-causing substances. In addition, red meat contains a few different things, especially when it's cooked at high temperatures. It can create unstable molecules on the meat itself. So right now, the recommendation is to really limit consumption of those processed meats, like the sausages and the bacon, and to consume red meat on a limited basis. This doesn't mean that, having a slice of bacon or a few slices of bacon 1 to 2 times a year is a problem. It's really for those people who consume a lot of meat on a regular basis. You can fill in your, diet. If you're used to eating 6 ounces of meat at your meal, make it 3 ounces and fill it in with some beans and some vegetables. So there's great tips on how to stretch out your meat and cut back on it, and add in some powerful cancer-fighting plants.
We were talking about this earlier, and Hillary said they should be vacation foods, not staples in our diet.
Great, thank you. We've also heard a lot about herbs and spices, and that they play an important role in a cancer-fighting diet. Which herbs and spices would you specifically, in particular, recommend that are beneficial to us?
Yeah, herbs and spices can be so flavorful, especially because the American Institute of Cancer Research does recommend limiting salt consumption. So it's a great way to flavor your food. Cinnamon, especially Ceylon cinnamon, is wonderful and a little sweeter on your breakfast, whereas turmeric and ginger are powerful anti-inflammatories and have a lot of cancer-fighting nutrients.
Yeah, salt intake was associated with all-cause mortality, so reducing your salt intake really to less than 1.5 to 2 grams a day would be beneficial for overall health.
Great. We have a question in regards to alcohol. Does drinking alcohol increase the cancer risk? And how much alcohol is bad for you?
This is something also that's been in the news, and they constantly kind of go back and forth. So a moderate consumption of red wine, specifically recently there was a study that looked at 6 ounces, reduced cardiovascular mortality, so it helped your cholesterol and was good for the heart muscle. But when we look at for cancer prevention, it's very clear that alcohol intake does increase the risk of certain cancers, specifically head and neck malignancies, liver cancer. So what we generally recommend is everything in moderation, but as long as you have between probably 4 to 6 ounces of red wine a day, you'll probably be okay.
I would agree, yeah. the recommendations for women to have no more than one alcoholic beverage, and for men to have no more than 2 if you drink already.
So it's something you have to watch.
Okay, great. I have a question in regards to genetically modified food. Do they cause cancer?
It's a really good question, and it's, again, something that comes up very frequently for us. What genetically modified means is that the plant was altered in some way to perhaps make it grow bigger, perhaps to resist pests. So they have been an important factor to being able to supply the population with enough food. All genetically modified things are not bad. In some countries, they genetically modify rice to include extra nutrients to make sure people don't get depleted of certain things. That being said, for people who are concerned about eating genetically modified foods, choosing organic automatically means that it is not genetically modified. Because these foods have not been around that long, we're not sure about possible long-term effects, but to date there hasn't been any studies showing that they are harmful.
Yeah, we're in a situation where there's not that much data out there, and so people who are concerned are advocating for the labeling of genetically modified foods, and we definitely agree with that. And so as part of a normal healthy diet, though, you should consume fruits and vegetables, irrespective of whether or not they're genetically modified or conventionally grown.
Okay, great. Thank you. It seems like there isn't a lot of information on that genetically modified food to date. But are there any superfoods that are important in order to help us reduce our risk of cancer?
I really say eat the rainbow. Think about how many colors from fruits and vegetables you're eating a day. Each color offers a different benefit, and the deeper the color, the better. So you want to get some dark greens in there, which are great for helping to detoxify your liver, whether that's parsley or kale or spinach. Some of the dark reds and purples, whether it's red cabbage, beets, cherries, also offer a host of cancer-fighting nutrients. So I usually say go by color, aim to eat 3 or 4 colors a day, and you'll be covering yourself.
Great.
And with that, try not to eat too much of one food or fruit. I've seen patients that will juice a pound of kale for breakfast in the morning, and that's definitely not recommended. So as long as you have a number of different fruits and vegetables in the diet, it's a good preventative strategy.
Absolutely, especially even something healthy like kale, when eaten in such large amounts, can be unhealthy. It can interfere with thyroid hormone and things of that nature. So we do want to make sure that you're eating a moderate amount in a variety of different colors.
Great. Are there specific foods for cancer survivors that they should eat?
That's a good question. Many times each individual patient and their treatment may have differing needs. So certainly that's something to talk to your physician about. But there are no specific recommendations other than the ones that we had discussed, continuing to maintain a healthy diet, healthy weight.
Yeah, absolutely. And this is a great time to mention, again, the American Institute of Cancer Research has specific guidelines for cancer survivors, but everyone is unique. Based on the kind of cancer you have, there's different recommendations.
So many of these tips, can some of these tips that we've done help people who already have cancer?
Yeah, so there have been studies in colon cancer that have shown that maintaining a healthy weight and exercising 30 minutes a day for a minimum of 5 days a week have actually prevented the recurrence of colon cancer. So I think as part of a survivorship strategy, you should talk to your oncologist, and they can come up with a plan not only for screening for relapse, but also to maintain that healthy weight, because it is very important.
For people who already have cancer and possibly are actively undergoing treatment, again, nutrition needs can change and vary vastly between people and between treatments. So we do recommend that you speak to your individual dietitian and physician to get a plan specific for you.
And what foods should cancer survivors not eat at all? Or is there something that you recommend for them not to eat? Somebody who is a survivor.
As a dietitian, I always recommend being able to include everything, making, again, most of your plate plants and having pretty much everything else on the side. But in light of the World Health Organization recommendation, I would say to avoid and really, really limit processed meats at this point. I don't know if you have anything else you want to add.
Not necessarily food, but I think reducing preventable risk factors, things like smoking. I think if you're a cancer survivor, smoking and you smoke would be the first thing to work on. And exercise.
Great. Do you think we should be filtering the water that's in our homes?
Yeah, it's a good question, and there are some great local sites where you can actually see the water in your local area to find out if there were any contaminants present or not. A lot of places will have a little bit of chlorine in the water supply, which can be removed with a simple carbon filter. Something like Pure or Brita or any of those will remove that and remove some of those extra contaminants.
We're lucky enough to live in an area where clean drinking water is piped into just about every house. Me personally, I like to use a Brita reverse osmosis filter just for taste, but your drinking water for the most part is completely healthy and safe.
Great. Is there anywhere online to find recipes to prevent cancer?
Yeah, there's so many great sites. Cook for Your Life has a great site with recipes. They just came out with a cookbook. Cancer Fighting Kitchen is another really helpful resource, as well as Meals to Heal.
What was that last one, Hillary? I'm sorry?
Meals to Heal.
Meals to Heal. Okay, that's great. I think we have all our questions covered. And if there was anything else that you wanted to add that you thought was important to share with us today?
So I would recommend every patient see their primary care doctor for general cancer screening. So what that means is thinking about mammogram screening for women over the age of 40. That would also mean cervical cancer screening with a gynecologist and a pap smear starting at age 21 for all females. You can talk to your primary care doctor about prostate cancer screening if you're a male over the age of 40. Going to see a gastroenterologist and start colonoscopy screening at the age of 50 for everyone. But in particular, if you have a family history of colon cancer or any malignancy, sometimes we start screening a little bit earlier. And so that should be an individual screening plan that's discussed with your primary care provider. These cancers are completely preventable if we enroll in a screening program very early. So make sure that you talk to your doctor about that.
I would also just say take advice that you find on the internet with a grain of salt. You want to make sure it's coming from a reputable source, such as the American Institute of Cancer Research, but you want to make sure that you're not getting misinformation. Everybody's unique, everybody's history is unique, disease is unique, so we really want to make sure that you're doing the best thing for yourself.
Every patient has their own unique medical history, and even doctors on TV, while their recommendations may be great, that they may not be the best for you. And so, so before you make kind of big medical decisions to start a new medication or supplement, make sure that you run it by your physician.
Great. Hillary, Dr. Mason, thank you so much for joining us here today and helping us separate some of this fact from fiction in such an important topic. And I want to thank our viewers for your time and say if you wanted to learn more, please visit the NorthShore-LIJ.com website, or you can call the North Shore-LIJ Cancer Institute at 855-858-8550. Thank you so much for joining us today.
Thank you.
Our pleasure. Thank you.